Today on APR Exclusive, we shall be delving into the effect of COVID-19 on health and finances across various states in Nigeria. My name is Udo Immaculate, and with me in the studio is
Fulfillment Maturacha. Later on the program, we will be joined by our correspondent in Makurdi, the Benue State capital. She will be giving us a situation report of the COVID-19 in Benue State and its environs. Let's take a short break, and when we come back, we will be delving into the conversation proper.
Welcome back. You're still on to the APR exclusive show on African Patriot Radio. Remember, you can follow us across all social media platforms at African Patriot Radio. Today, like we said earlier, we'll be talking about the economic and
without the use of excess manpower. So now it has become a problem because health-wise, it's going to lead a lot of people to fall into depression.
Yes, talk about unemployment. The unemployment rate is actually going to be on the rise after the COVID-19 does pass by, because a lot of companies are learning that they can work remotely. They don't even need people to come to the office to do this work. So you can work from home. What's the need to come to the office? Because people pay transportation allowance, and now you can work. They are like devising smarter way of doing business. Yeah. People might be redundant because the employers will come to realize that these people are not productive. You don't need them in the offices. So if the business can run without them, why do I need them back when the COVID-19 phases off?
Yeah, we could also say that some people have been advised to take measures to engage themselves while at home. But I would also put it out to everyone that before you can take online courses, before you can learn stuff on YouTube, you need data. And so gradually, each and every one of us really need to speak up about these issues.
It falls back to the fact that regardless of the fact that we're at home and that we're not working and we're not earning, that our bills don't stop coming.
The bills will definitely keep generating.
Yeah, so I'm thinking maybe the government should look for a way to partially or fully suspend bill payment for now, like say March and April. We should not pay for light bill. We're not working. We should not pay for water bills.
It is obvious already that we'll have a rollover of that as time goes on. So what's the essence of holding back all the money when you could use it to do other meaningful things for any Nigerians to, get themselves back on track? Because I can tell you for a fact, a lot of people will mostly die of hunger than of coronavirus in recent times.
True that, because people have to stock up, and when they run out, what do? Because they are not earning on a daily basis, like they don't have funds, and when you run out of funds, this might actually create pockets like security threats in the society.
True. Okay, also considering the fact that a lot of people, considering the health implications, will not be able to feed well. Okay, it is one thing to eat and it is one thing to feed well and eat healthy. So yes. it's very important. We don't have to overlook it because it is going to face us and hit us so bad.
Maybe we should be asking ourselves, what's in your plate?
Exactly, what's in your plate?
Because I was at the supermarket the other day, I was trying to stock up and I saw people are feasting on junk. So what you see people pick are cornflakes, cereal,
True.
So are people actually going to like engage in emotional eating?
And
you know that when you're depressed, you're bored, you tend to eat
and then
more.
conditional eating still come in place. We don't know how long this is going to last. We don't know how well we will feed. So why don't you just try to get up food, balanced diet, and then distract yourself?
Maybe you should engage in a workout plan.
Exercise processes.
You don't need to go to the gym. Yes, you should exercise at home, and then there are DIY courses you could do. And even the coronavirus, everyone's talking about getting chloroquine, boosting your immune system. Are there not things we can do at home to help our immune system?
There are home remedies actually, which have not been highlighted or emphasized.
Maybe the media should do more at projecting.
Yes, the media needs to sensitize these people on how best to manage these home remedies to manage and stay afloat of the coronavirus.
At this juncture, we'll be joined by our correspondents in Makurdi, the Benue State capital, where there is currently a controversy as to who is and who isn't infected by the COVID-19 virus. Hello, Susan.
Yeah, hello.
Yes, good afternoon, Susan.
Yeah, good afternoon.
How is Makurdi today?
Well, Makurdi is really hot.
Indeed, it's hot here in Abuja as well. Susan would like to get a situation report as regards to COVID-19 in Makurdi.
Okay, well, a lot has been going on here since the first case of the COVID-19 was confirmed in Benue State, Makurdi, on the 28th of March. So the governor actually came out, Governor Samuel Otom actually came out to announce, after he had a meeting with the action committee that has been put in place to contain the spread, he came out and said that the case has been confirmed and that it was out of the 8 suspected cases of people who came back from the United Kingdom. So out of those 8 people, 1 person was now confirmed to have the virus, and he also came out to state her name. He said her name is Susan Okpe, and advised that anybody that had come in contact with her in the last 14 days should submit themselves for test and for isolation.
That goes to say it's no longer a rumor, like it's a confirmed case right now.
Well, the government NCDC has actually confirmed it, so yes, it's a confirmed case.
Do you have an idea if there are quarantine centers currently? Where is she being kept? We hope she's not being kept like in a health center where we have other sick persons.
Well, actually, she was first taken to a private hospital, but she has been moved to the teaching hospital. So right now, that's where she's at.
Okay, Susan, has there been any measure to contact those people she might have come in contact with in recent times?
Yes, actually, the first hospital where she was taken to, there was some medical people that attended to her, like some nurses. And funny enough, there was a nurse that attended to her, and when that nurse went home, it was said that her landlady drove her away. So the nurse had to run away to the village, and now she's being searched for so that she can be tested and quarantined. So the people that attended to her in the first hospital and other people that have met with her before she was found out to be positive, the announcement has been ongoing, and her name has been stated and mentioned that anybody that has had contact with her in this past 14 days should come out. So for now, nobody has really come out to identify.
Okay, Susan, do you mean to say that there is a suspected case of the coronavirus at large in the person of the nurse right now in Makurdi?
Yes, because the nurse attended to her and went home and was driven, because the whole scare and the whole panic that led to the landlady driving her away.
And now she has to go to the village.
Yes, if she has not been confirmed to have it, but the thing is, she's being sought for as we speak, so that we can at least test her and be sure that she's safe.
Isn't this a cause of concern? How has the people of Makurdi reacted to this news or this information?
Okay, well, a lot of reactions. Some people are saying, because the said lady did a Facebook post where she was saying she wasn't informed, the press conference was done, and she doesn't know how she was confirmed to be positive. She experienced symptoms and felt better, So there was actually a post where she was making a statement like she's not positive, and she doesn't know why the NCDC came out to say she was. But there are other people saying that the government did right to have done that. That if the government, because the deputy governor, who is the head of that committee that is trying to curtail the spread of the virus in the state, actually confirmed, and also the NCDC confirmed that the case was, the patient actually tested positive for the virus. But some people are saying the government did right because they are trying to, safeguard the lives of other people.
Do you think the government has done enough? Because the nurse in question is actually at large.
Well, I think the government is trying. They'll be setting up some quarantine centers here and there, and they're actually looking for her. I think, So I feel like they are, so to speak, they're doing their best.
Okay, Susan, do you see or do you think that Benue State will go on a lockdown soon?
Well, they are actually partially on a lockdown as we speak because there's a curfew that has been imposed on the state.
Okay.
From 7 p.m. people are not allowed to go out, and also at transport places, there's lessened activities. People are not traveling. Few people are barely traveling right now. So most of those transport companies are shut down. Just a few, and I think from the way things are looking, anyways, since the cases are not many, I do not know, but they have already started shutting down. They've even stopped staff from certain levels, to stop going to work, except those that are essential staff. So, going from the look of things, I think that subsequently it might be more than this.
Oh,
so
okay.
We might face a total or complete shutdown.
Yes, but for now, no.
Okay.
But, yeah.
Thank you very much, Susan. Thank you very much, and please do enjoy the rest of your day.
All right, you're welcome, Emma. Thanks.
We'll go on another break, and when we return, we shall analyze the situation in Makurdi.
My name is Josephine Paul.
Susan Achin.
Yao Bremen. Jude Ojema Audu.
Second Zilang.
Richard Bassi.
Ekanem. I am Messi Joe, and we are
African Patriot on African Patriot Radio.
Welcome back. It's still the APR exclusive show. You can follow us on all our social media platforms as African Patriot Radio. Before the short break, we were discussing with our correspondent on Benue State's controversy going on now of the person that was suspected to be positive.
Or has been confirmed to be positive.
Yeah,
she
has been confirmed.
The cause for concern actually right now is the lady nurse that attended to her that's currently at large and nobody knows her whereabouts.
But Immaculate, do you think it was right for the government to have let out the name of the lady that tested positive?
I think it leaves room for stigmatization, considering that NCDC, they actually give us statistics and they do not let out the names. It's actually against the law. I have reason for concern that this lady is at large, she's out there, we don't know who she would meet or who she would come in contact with, thereby spreading the virus, and here's the government trying to curtail or contain the situation.
Don't you see from the angle of the fact that releasing her name to the public was actually to help get to find out people she might have been in contact with?
It's not enough to release her name. Okay, now they said Susan said that she did a Facebook publication that actually puts a face to the name. I think that will help Nigerians to see her, but I'm scared that people might lynch her because this is like a suspected case. She hasn't been confirmed to be positive of the COVID-19 virus. So how about the lynch her on site?
We've heard that the Benue State government have put in place quarantine centers to help manage the spread of the virus. And also, we also heard that they are on a curfew for now, or from 7 p.m. no movements are allowed.
And they might face a possible total lockdown should the case increase. And now that's my fear when they say this lady is at large. I just hope they put in place more measures to contain the situation before it escalates or goes beyond what we can handle.
We hope so.
Take a short break. When we return, the show continues. Do not forget, it's APR exclusive on African Patriot Radio.
Welcome back. This is still the APR exclusive show on the African Patriot Radio. We will be joined in by Dr. Golwa Philemon, the Chief Medical Director of the Plateau State Specialist Hospital, who will be giving us the situation report of the COVID-19 in Plateau State. Good afternoon, Doctor.
Good afternoon.
How is the Plateau today, sir?
Fine, we're doing great.
Okay, sir. So I would want to know the situation of things in Plateau as far as the COVID-19 is concerned.
Okay, what's happening is that people have a lot of agitations, a lot of tensions But thank God, we've not had any single case or index case for now.
Okay.
So we're up and doing, trying to make sure that our isolation center is well equipped.
Okay.
And trying to do some training for the isolation center.
Okay, sir.
Okay, so we're going to ask, how proactive is the government? How ready are they? As though there are no cases right now, should there be a case tomorrow? Do you think the government has done enough preparation?
Very, very proactive. I'll give you a typical scenario. The governor called everybody on board, and we had several meetings, and we gave him a budget in the interim, and he made the adequate releases to make sure whatever that is there to fill the gaps have been made. So I think everybody is up and doing. We are very proactive about that.
So far, sir, how many quarantine centers are there in place? Or are we waiting to have a case before we start talking about isolation in quarantine centers?
Well, we have a very large quarantine center in the old Jute, and then we have also 3 isolation centers well furnished. And then across the senatorial zones also, we'll be able to create some isolation centers for the 3 zones that we have in the state.
Okay, sir, does Plateau State have provision to carry out this test in case someone shows up with symptoms of the COVID-19 virus?
Yes, well, like I told you, we don't have an index case, we don't have an incidence case, but we are just making these precautionary measures so that we'll be able to contain in case peradventure something happens. We are struggling to make sure that it is done correctly.
In order not to leave our borders porous, like other cities have lockdown, like there's a sit-at-home order right now in Abuja and across several states in Nigeria. Is there a sit-at-home order in Plateau State?
Well, yes, like what the governor has said, he has ordered junior cadres to be at home, to stay home. I know the basic standard treatment is basically, it's an important disease, so people are expected not to come, so that until we have circumvented the whole subject matter.
Okay.
So for now, people are not supposed to be around, and then he has put a task force to ensure that anybody caught violating the law should be appropriately dealt with.
Okay.
So I think he has made it a universal mechanism, and then basic sanitation mechanism with basic hand wash and sanitizers were all available. Government has been able to make some substantial provision for all these things.
Okay, doctor, we'd also want to know if the sit-at-home order, it's a total sit-at-home lockdown, or it's going to be the curfew will commence from a particular time to a particular time.
Well, yes, it's working in several ways, but you know what Nigeria is. They give a law and so many people are ready to disobey, and that's why the task force is struggling to make sure that those who are violating the law are punished. So the sit-down law is a very good order because this virus is an imported virus. If everybody says you won't be able to import anything to your home. So that's why we're saying that the law must be enforced and it has to be strictly followed.
Okay, so you've said this is like a partial shutdown. In case there are cases in the near future, do you foresee a total shutdown of the state?
Well, yes, that's why we're watching the atmosphere and seeing what will happen. If eventually we feel that the influx of the neighborhood states is going to affect us and they are bringing a disease to the state, definitely the governor will be advised on a total shutdown.
So in recent time, people have, over time, I think they have like imaginary symptoms of COVID-19. What are those things that people should look out for in their day-to-day lives that will make them call the toll lines and say, maybe I do have the COVID-19 virus?
Well, yes, when there's a history of exposure to somebody who has just come from another neighboring country, a neighboring state. For example, the states that have the virus, we already know them, especially the ones that are very close to Plateau State. We have Bauchi here, we have Kaduna, and we have also Abuja and Nasarawa. So by the time anybody will just come into the state, we will have a short history of exposure or contact to that person, and eventually we will now check whether the man is developing symptoms. Okay. The basic symptoms that we're all aware is headache, fever, cough, and running nose with sore throat and other feelings of body pains and malaise.
But sir, aren't those symptoms of malaria as well?
Pardon?
Are those not symptoms of malaria as well?
Yes, these are they are symptoms of malaria, but you see, this particular fever is characteristic. It does not follow the malaria pattern. You know, the malaria fever, it goes up, it comes down. And it can come down to even a lower base. But for the viral fever, especially for the COVID-19, it doesn't come back to its original base. It keeps on spiking until one is overwhelmed with the fever.
Okay, sir. If it happens to be that someone experiences the symptoms, please, what are there toll numbers to call to get assistance and to be taken care of?
Since we're not expected
to come to the hospitals.
Well, yes, we have opened up toll gate numbers, and they are free for everybody. We have been singing over and over again on the radio and other media. So if anybody has anything like that, it's free to make the call. Or if you suspect somebody close to you having the same thing, you report immediately to the emergency center that is having the call numbers, so that they can be able to give him help.
Please, sir, can you do us the honor of calling out the toll numbers in case our listeners might want to take note and write these numbers down?
You say your own toll numbers?
Yes, the toll-free numbers, yes, where people can call.
Yes, they are there, but I have not crammed it off yet. But I'm sure if you want me to send the numbers to you after this interview, I can send them to you.
Okay, sir, I would appreciate that. Thank you very much, sir.
It's okay, that's all right.
Thank you very much, sir. Have a beautiful day ahead.
Thanks a lot.
All right, thank you, sir.
I'm grateful.
And that was the Chief Medical Director of the Plateau State Specialist Hospital, Dr. Gulwa Philemon, and he has been able to sensitize us on the fact that the Plateau State is ready and prepared to handle whatever case may arise.
Yes.
And so, Immaculata, I think the Plateau State is prepared for this because this is what everybody should have done and should be looking out to do.
With what he said, they're proactive, and I think that's what Nigeria as a whole, as a country, as a nation should have done. Be proactive, but we left our borders porous, and now we're actually paying for that.
We hope that the virus doesn't spread further, and even if it does, we are very sure that with the measures the Plateau State government is putting into place to curb the virus, it will be limited, and then we will overcome this virus. That is it for today's show, but you can join the conversation on our social media platforms at African Patriot Radio, and my name is Fulfillment Nwaturaja, and with me is...
And I am Immaculata Udo.
Stay positive.